Hi guys, Johnny and Paulina here, and we're looking at high ankle sprains or syndesmosis sprains, and we're talking about the squeeze test. So the squeeze test is one of the tests that you might do if you suspect a high ankle sprain, so a injury to some of the structures around here. So high ankle sprain, so you're looking at your syndesmosis or your inferior tibiofibular joint. So you've got your superior one here, your inferior one here, and what this joint does here is it keeps the fibula attached to the tibia. Few structures do that. So you've got your anterior inferior tibiofibular ligament, you've got your interosseous membrane, interosseous ligament, and then at the back you've got your posterior inferior tibiofibular ligament as well as your transverse ligament. And in some anatomy books those two ligaments are said to be the same type of ligament. So what the syndesmosis does, again, it stops the fibula from migrating or going on a little trip away from the tibia. And the theory behind the squeeze test is if I was to squeeze up here, it would cause a splaying of the fibula and tibia down here. And if the patient reports their pain, then that's a positive test. So we'll talk a little bit more about that in a second. So the test goes that I would squeeze the tibia and fibula together here. If the patient doesn't report anything, I move down the length of the limb. And if she reports pain when I squeeze here, in comparison to if she reported pain when I squeezed here, so the further, more proximal, so the closer to the head that she reports symptoms down here, so the symptoms always have to be here, it's not symptoms of where I squeeze my hands, then the higher up the squeeze that reproduces the pain, the more severe the injury. So I squeeze here, the patient tells me no pain. I squeeze here, the patient tells me no pain. I squeeze here, the patient tells me pain. And her pain is around here, or over the AITFL, or the syndesmosis, or the inferior tibiofibular joint, then that's indicative of a positive test. Now, myself and Paulina had a chat about this earlier on. We would never use one test in particular to diagnose a high ankle sprain. So, firstly, we're going to get all our clues from the subjective. That's going to give us, over 90% of the diagnosis. And then we're going to look at a number of tests. And we've done some videos on this already. So we would do this test, and we would do the external rotation test. We would look at their mechanism of injury. We might do a stabilization test, which is in another video. We might put a link in the bottom. I'm not sure if we will or not. So we would look at those. But again, it's probably a combination of tests, mechanism of injury, and a huge amount of information from the subjective. So that is the squeeze test, which can help you along your journey with regards to diagnosing a high ankle sprain. Again, the problem with any of these types of tests, it depends on the experience of the clinician, and you have to have a good relationship with the patient as well. So they've got to be a good historian, and they've got to be able to accurately present a picture of their symptoms. So that is the squeeze test.